Hello, everyone. It's Wednesday, June the 17th. I'm sorry we're a little bit late getting started and everything. You know, there's lots and lots going on. We've been running here and there and everything, and but anyway, nevertheless, good day, good day from the standpoint of we do not have any additional deaths to report since last Friday. That's really good stuff. We've got a total of 88 deaths in West Virginia. I've said it over and over, 88 too many. Great West Virginians we've lost, and they've all got a name, and they've all got a family, and they've all got loved ones, and they've all made an incredible contribution to our state. So please continue to keep all those in your thoughts and your prayers, and we'll some way, somehow get through this. We have tested in West Virginia so far, I think the number now is 138,256 people. That's an incredible amount of testing. We will soon reach a level of where we have tested 10% of our population. Still got a ways to go there, but we're going to get up in the high 1.7s or 1.8 as far as million people, and we're going to be at 10% of that before long. It'll take 170 to 180,000 total tests. Like I said, we're at 138,000 right now. This is week 8 of our West Virginia Strong Comeback Reopening Plan. We have no additional reopenings this week. Week 9 begins June the 22nd, and I think you'll see that coming up. And our guidance for these businesses is available now on my website. I guess the primary thing that we need to talk about today, is just this, is what's happening in our churches and what's happened in Greenbrier County and what's now is going on in Ohio County and what we think is going on now in Boone County. And so the bottom line to the whole thing is we have 6 church-related outbreaks as of today in 6 counties. 3 are still active and 3 are resolved. The active outbreaks are in Greenbrier, Ohio, and Boone counties. From the Greenbrier County minority and vulnerable population-free testing that was done on Friday, Saturday, Sunday, and Monday, there were a total of 839 people that were tested. There are 8 positives out of 815 results we have so far, with 24 tests still pending. There are 32 church members that were tested, and some of these were tested prior to the 839, but there are 32 church members that tested positive in this outbreak in Greenbrier County. Now, if I could just stay with Greenbrier County just 1 second and just say just this. Again, there's no point in belaboring. The reality is just really simple. When we don't adhere to the guidelines as far as mask or social distancing or every other pew or all those things that are our own choosing, but guidelines that we have given you, we're asking for it. We've got to all know that while church is surely the most sacred ground, it is the spot where we're singing and we are projecting our voices and we're closer together and there's more elderly there and all the things that make it just ripe for an outbreak, a potential problem. We have got to protect ourselves there. I mean, that's all there is to it. We've got to wear our mask. We have to wear our mask. We absolutely have got to stay in family units, and we've got to stay at a social distancing that absolutely protects us. If we're going to go to church, we have got to do this. because not only do you run the risk of yourself and your family and your other church members, but you go to Kroger's. You know, you absolutely run the risk then of contaminating, and community spread becomes a great big time issue. If we're going to continue to go to church, we have got to realize that church is one of the biggest targets that this probably evil characteristic of a virus can target. So we have got to be on special caution and special smarts as we go to church. Now, unfortunately, the Wheeling, Ohio County Health Department is currently investigating another church-related incident. The outbreak at present, there are 4 cases that were identified, with additional cases anticipated in the days to come. Again, I want to strongly encourage all West Virginians, especially when in church settings, to follow the guidelines and use every other pew, maintain social distancing, and wear a mask. Please wear a mask. A lot of the attendances at our churches are those that are elderly and at higher risk. I am also cautioning everyone to strictly, again, follow the guidelines. Now, we got to do this. We have to do this, or we're going to end up with people dead. Really and truly, in my hometown in Lewisburg, if we don't lose somebody there, it will be another miracle. Absolutely, we have got to do this. We've got to realize just what I said. Church, our most holy and sacred ground, absolutely could be the #1 spot where the biggest possibility of an outbreak can happen. Please listen to the guidelines. As far as our proms, we get a bunch of questions in regard to the proms. There's nothing I can do about this. Unfortunately, proms still cannot be allowed. It's not only extremely difficult, it's for all practical purposes impossible to keep social distancing indoors, and especially when you're having close dancing and singing. I hope, like graduations, we can get back to holding these events, but it is not at this time. Our unemployment numbers. Workforce West Virginia reported that West Virginia's unemployment rate dropped to 12.9%, down 3% from where it was in May. The number of unemployed state residents decreased by 23,400. We went down to a total number of 100,400. The national unemployment rate's 13.3. Ours is 12.9. To be perfectly honest, our unemployment rate in West Virginia is not very often lower than the national average. It is right now. It's not a whole lot to be terribly, in the mood to celebrate at this time, because we're still looking at an outrageous unemployment rate. Think about this just for a second. How long ago was September? I mean, how long ago was September? Only just a few months ago. At that point in time, the national media was calling us like crazy, and we were reporting an unemployment rate in the month of September of 4.6%. Today, we're celebrating in a little bit at least 12.9. 4.6% in September, just a few months ago. The whole world turned upside down. In all honesty, in every way, we should just see how fragile we are, how fragile we are as human beings in a situation to where our whole world changed and changed just like that. So we're on our way back. We're battling in every way. We're saying prayer after prayer to God above to help us, and He's helping us every day. We're going to get back. We've still got a long ways to go. I want to remind everybody about our free testing for our minorities and our vulnerable West Virginians. This Friday and Saturday, June the 19th and 20th, we'll be in Ohio, Putnam, and Summers counties. They're up on the screen. And all of this testing, like I've said many, many times before, it's optional. It's absolutely free. It's painless. We are targeting our minorities to get more and more information that we can possibly get there, or our more vulnerable people. Come and get tested, please. If you have any anxiety levels, come and get tested. You'll see up on our website, all of our stuff in regard to our cities and our counties and their application for CARES Act reimbursement. We have completed 47 reimbursement application reviews. There are 49 reimbursement applications that are pending review. The total number that we have recommended of dollars out the door to date is $9,585,260.50. That's going out the gate, and everything is going to these counties and cities as fast as we can get it out the door. I underline again, we can't get it out the door any faster than there is, for the fact that we have to abide by the guidelines that we have, but they've been relaxed, and we can get a lot of dollars out. I promised you that millions of dollars would be flowing by last Friday. Today is Wednesday of the next week. Last Friday we had 2.6 million out. Now we've got 9.5 million out, and it's just going up more and more and more each and every day. I want to caution you again, or tell you again, about 670 sites. It's our summer feeding map project. So if you have any questions whatsoever about that, call the number 211. We'll assist you in every way and help you out as far as being able to direct you to where to go. And we want all of our people to be fed, and those sites are assisting us in every way. On a jail update or a correctional facilities update, there are a total of 13 active COVID cases now at 4 jails and 2 prisons. The enhanced testing results are posted on the COVID-19 website. This is a story of absolute wonderful success thus far. We all want to continue to be concerned and know that this thing could whip right around and hurt us in any way. But thus far, those people in corrections and all the different people from our National Guard to all of our health communities and everything else, as we ran to the fire at Huttonsville, you'll remember Huttonsville had 120 or so positive cases and everything. Now we're down to 13 active cases, at 4 jails and 2 prisons. Really and truly, we've not lost a single person, and a lot of good work. Really proud of everybody. I remind everybody again about the census, that we've got to get counted. We're running out of time there, and if we're not counted, we're just going to throw away money upon money upon money, West Virginia. And there's all kinds of programs, and there's all kinds of kids. There's all kinds that we can help in lots of ways. We've got to get counted. I want to mention that today we're joined by Dr. Marsh, Dr. Slim, and Secretary Crouch. You'll see that we have a vacancy today in General Hoyer. He couldn't be with us today. He had a previously scheduled engagement, and we always miss General Hoyer, but in his absence, I want to thank him. What a superstar. What a superstar. And what great work they've done. So nevertheless, that's all I've got today.
All right, thank you, Governor. Let's first go to Dr. Clay Marsh, our coronavirus czar.
Good afternoon, and I once again want to echo what the governor has said. There are some news reports both in the paper and on television that West Virginia is seeing a substantial increase in the number of COVID positive tests. And I think that when you start to pull back the curtain on that a little bit, these are really reflecting these outbreaks that we've seen in our churches and these community congregate settings, and also some people who have traveled and who have come back to West Virginia from higher endemic areas. And we've talked a lot about the fact that people who spread COVID oftentimes aren't aware of them even being infected. And that's what's so important about all of us wearing masks, because remember, masks don't protect you from others as much as they protect others from you. They reduce the droplets that you produce. We also know that as we're coming back together and we are focusing on the 3 C's that we've learned from Japan, avoiding crowds, avoiding closed spaces, closed indoor spaces, and avoiding close contact with people that you don't live with all the time. That's really been one of the risks that we acknowledge and knew even going in for our church congregations. And as the governor said, that's why it's so important for us to follow these guidelines, but also for other indoor places. And just as an illustration of this, there was a report that was out yesterday where 16 young people that were having a birthday celebration in a bar in Florida that was very crowded and they weren't wearing masks. All 16 of them got COVID infection. So ultimately, we are vulnerable to this virus. Most people in West Virginia have not been infected, as we see with our low rate of positivity. And so it's really important that we adhere to these guidelines and recommendations so that we continue to be able to open West Virginia safely. And the last thing I'll say is that I know everybody wants to continue to see our businesses open, to do the activities that you prize and value, to see the beautiful nature of West Virginia. And we worry about our economy and economic sort of growth and progress as we look at this COVID pandemic. I think what's really important to realize is that the risk of having businesses and other events shut down by COVID is really very much predicted by how much COVID you have in the communities that surround these businesses or venues. And so as we control the rate of COVID positivity by protecting ourselves with masks and physical distancing and hand hygiene, then we also protect these vital businesses to be able to stay open and allow us to continue to open up other activities and other venues that we all want. So being safe and protecting yourself is not only good for the health of people in West Virginia and in our communities and vulnerable people and healthcare assets, it's also good for our economy. And the countries that do the best job of supporting the health of their population and reduce the spread of COVID are the ones that are also doing very well economically. So these things are really tied up. And we know that you in West Virginia are doing a great job, but don't get complacent and don't get fatigued. It's really important that we're all together now and we're doing the right thing. So thank you.
All right, thank you, Dr. Marsh. Secretary Bill Crouch and Dr. Cathy Slim from the West Virginia DSHR are also joining us today and are available for questions. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. The first questioner today is Brad McElhenney with West Virginia Metro News.
Hi, Governor. Can you tell us if any of the people who have been involved in the church outbreaks have been hospitalized? Trying to get a feel for how serious these cases are.
Brad, to the best of my knowledge, there is one person that's been hospitalized. I don't know the severity of the hospitalization yet, but from what I know, there's only been one hospitalized so far.
Okay, thank you, Brad. Next, we'll go to Phil Kabler with the Charleston Gazette-Mail.
Given the outbreaks and the understanding that mask wearing is an effective means to control the spread of this virus, wouldn't the logical next step be to mandate wearing a mask in enclosed places statewide?
Phil, I would be, to be perfectly honest, I would be a proponent, but at the same time, you know, I guess the bottom line of the whole thing, and I'm stumbling in some ways, but the experts tell us that if we reach a level of 60%, we have good things happen. If we reach a level of 80% of people wearing masks, you know, it becomes tremendously effective. Now, the $64 question, though, is just this, is if you mandate somebody to wear a mask, and some people are still going to refuse wearing masks, and before you know it, you're running around like a policeman, you know, trying to get somebody to wear a mask or not wear a mask. And before you know that, the one thing that we have, the beauty of West Virginia has been just this. The people have listened, and the people have really trusted me, and our numbers show it. The numbers have been phenomenal. How have we been able to do that? And the reason we've been able to do it primarily is we've stayed together. That's the one thing that I keep weighing out that I don't want to do. I don't want to divide us. I want us all pulling the rope together. Now, if you tell people at a church setting that they should definitely wear masks indoors or singing and doing everything under the sun, they should definitely wear masks and they don't, well, I can't go sit in every church and see that they're wearing masks or not wearing masks. But absolutely, Phil, you know, I would not be adverse to saying the mask have to be mandatory, except for one thing, and that is just this. I want good West Virginians to all be together. And I don't want to start mandating things on West Virginians that could potentially divide us. It's a tough call. It's a tough call. If we get to this and these numbers start to deteriorating more, that's the next step we'll move to.
All right, thank you, Phil. Next, we'll go to Steve Adams with Ogden Newspapers.
Yeah, Steve Adams with Ogden Newspapers here. My question is this, and it's related to Phil's, but it's sort of, there's got to be a step in between here, between mandating it, which would probably push people to kind of rebel against that, and educating people more. Obviously, you all have spoken here. Dr. Marsh has spoken here about the issue repeatedly, but obviously not everybody watches these briefings. And to some extent, unfortunately, mask wearing has become part of this greater culture war that you see out there with, you know, maybe some Trump voters out there that specifically won't wear a mask because they feel like they don't want to be told what to do by the liberal media or some sort of nonsense like that. So what's the step in between? Because obviously you don't want to mandate, but obviously just constantly saying, please wear your mask isn't quite enough either. Thank you.
Well, Stephen, and I'll let Clay weigh in here, but because Clay preaches every day, and everywhere I go, I mean, I try to preach exactly the same thing every day. From the standpoint of our educational community, or, they're preaching the same thing every day. in all honesty, I think you'd almost have to live in a cave somewhere to not heard that if you go out to a public building, you know, you should wear a mask. And I would believe you'd have to almost live in a cave that if you didn't hear somebody say that the countries where it has become commonplace, the amount of outbreaks, the amount of deaths are so drastically dropped, it's unbelievable. And I have said every day that the level of inconvenience to wearing that mask is so minuscule compared to losing a family member. It is nothing and everything. And so you know, Stephen, you know, you're a great man and do a great job and everything else. And if you had any way or mechanism that I can get the word out better that I'm missing, please tell me. But I'm just, you know, I'm trying with all in me to make sure that our people understand what they got to do.
All right, thank you, Steve. Next, we'll go to Kenny Bass with WCHS.
Hi, this is Kenny Bass with Channel 8 and Fox 11. With what is going on with churches in the state, does it give you pause, Governor, or you, Dr. Marsh, about we're moving ahead with youth sports, we're moving ahead with practices, we're moving ahead with a number of activities where people will be together in kind of like life getting back to normal? We've seen outbreaks from the University of Alabama and several major universities across the country. WVU had a positive test. Whenever you start bringing people together, these things seem like they're inevitable. So is there any thought to, as much as it would be terrible for kids, to put the brakes on youth sports until we get a better handle either on infection control or mask wearing, or there's some type of medication or vaccine available? Thank you.
Let me try it again, guys, because this is all coming back to me anyway. But let me just say this, Kenny. I've said it over and over each and every day almost. This situation is totally fluid. You know, we're going to have to adjust as we go and continue to adjust. You know, that's all there is to it. Now, if you just think about it, probably before we had the big outbreak in Lewisburg, things were really trending in really a pretty daggum good way. Then all of a sudden now we've got outbreaks in Arizona and Florida and Texas and surely North Carolina, and we're thinking, you know, do we back up? Do we slow down and everything? That's a constant process here. And so just like I pulled the plug, you know, on the state tournament and schools and everything else, if we see these numbers start to move in a way, we'll pull the plug. That's all there is to it. Right now, our cumulative percentage of positive today is another record. Now, I think the other day it was at 1.74, and today it's at 1.71. You know, we continue to do even better, and I think that's correct. Let me just double check that, because I want to make sure it wasn't 1.70. Well, I don't have it, but I think it's another record. And so as we continue to produce these kind of numbers, I think we can continue to allow people to have their lives as close to normal as we can. But at the same time, Kenny, we're watching. We're really watching, and you know, if we can't get it down pat on how to wear a mask and how to protect ourselves and everything else, then we're going to have to start reeling back and just taking things away. We're watching what's going on all across our nation, and we're watching what's going on our neighboring states, and we're watching what's going on everywhere here.
All right, thank you, Kenny. Next, we'll go to Anthony Izaguirre with the AP.
Hey, Governor, can you give us more details on the active church outbreaks? What are the names of the churches, how many cases, and how many tests are pending?
It'll all be on our website stuff and everything, you know, or maybe not on the websites, but, you know, well, I just was listening to someone here, but Anthony, you know, the Greystone Church in Lewisburg is a church that I knew the name of, but Dr. Slim, I don't know the names of these other churches and everything, but Dr. Slim may be able to give us some information on that.
I would leave the specific investigations to local health departments because they really have the most accurate, up-to-date information. The counties that we've been talking about, of course, are the active ones currently have been Boone and Ohio and Greenbrier, and that's really where those have been occurring. The Boone County outbreak, as I believe the governor mentioned, is at 8 individuals who have attended, and one additional who was a contact. And I think that's an important thing to remember with all of these. It's not just the individuals that attended an event and shared it in the church, but each of them have contacts elsewhere in the community. And so it's really important to make sure that we do the appropriate actions in each of our settings so that we don't spread it further. We've seen 55 to 60 cases across these outbreaks of attendees of the service, but another 25 to 30 individuals who have been contacts of those cases. So I think that's really, it's important that we follow these guidances that the governor has laid out across the system and in our everyday lives outside of those church settings as well. It's not unique to the churches.
Okay, thank you, Anthony. Next, we'll go to Annie Moore with WVVA.
Hi, Governor. We know of at least one person that was never notified of the outbreak at the Greenbrier Church that was there that Sunday. Are y'all running into any issues with contact tracing?
I think, guys, you guys are going to have to, the medical community is going to have to, you know, to handle that.
Certainly, the health departments do that locally, and there always are a few individuals that it's difficult to find or identify. They continue to work through that locally, and really they do this every day, so they keep doing that. They also, we realize and know that there are lots of local attention to these activities, and people hear about it and ask about it, and so typically folks are able to track folks down over time. Anyone that's got questions, we always refer to the local health department because they have the most accurate information to doing that. We also encourage the churches themselves to really actively reach out to any of the members that they have. We ask them to notify their members. We actually ask them often to be public about it and kind of speak to what's occurring so that they can make sure everyone in the community has been notified and aware, and that they also have the opportunity to really talk about the proactive things they are doing to make sure that they are safe moving forward.
All right, thank you, Annie. Next, we'll go to Taylor Stuck with the Herald-Dispatch.
Hi, everyone. It's Taylor at the Herald-Dispatch. I got a press release this morning from the American Red Cross, and they are offering free antibody testing if you donate blood. And so it kind of got me wondering, what would be the benefit of having antibody testing for just like a regular person?
Okay, guys, Dr. Marsh or somebody handle this other than me.
Yeah, I'll take this one on. So the antibody testing for our population as a whole is probably not greatly beneficial. If we know of someone that's had a COVID positive test, the antibody testing would tell us and them if they've recovered from that test. We know that in very, very densely affected places like New York City, that the highest antibody positive test that's been recorded that I know of is about 23%. And in the country like Sweden, which has basically gone without any mask and with the idea that they were going to get infected, have their population infected to try to get herd immunity, which is basically enough people infected to stop the spread of the virus, which would be about 70% of their population. They just recently tested and they're only at 7%. So antibody testing for most people in West Virginia would not be indicated, nor would it be that helpful for particular subgroups of people, first responders, hospital personnel, people that have been infected already, people that might want to donate serum with antibodies to help people that are not immune, to try to give them some level of immunity. Those will be areas that antibody testing might be indicated for West Virginia.
All right, thank you, Taylor. Next, we'll go to Molly Bourne with West Virginia Public Broadcasting.
Hi there. I was wondering if you've been tracking out-of-state visitors down near the Hatfield-McCoy trails, if you'd consider being stricter with health guidelines there. And also, Governor, if you could talk about your views on Confederate monuments. The Harrison County Commission voted not to remove a statue of a Confederate general today in front of the county courthouse. Thank you.
Okay, I'll take both of these. You know, from the standpoint of the visitors in the Hatfields and McCoy's trails, you know, I don't know of any issue that we have that we're tracking anyone right at this point in time. As far as I know, things have been amazingly quiet there compared to, the potential concerns or worries that all of us have about everything. Now, I would really surprise you about your second question, and it's just this is, from my standpoint, here's how I feel. I feel like that our capital is a place, to where I want everyone to always feel comfortable and at ease. And from my standpoint, the legislature, there's many steps. It takes the legislature decided on the monuments that were here a long time ago, 100 years maybe ago or more. The legislature is going to have to decide if there's stuff removed, I think. That's really not my decision. Plus, you've got all kinds of historical societies that may have the rights to these monuments, themselves. But if you're asking me, Jim Justice, I would tell you just this, and this is not a political answer, you know me, I'm going to just tell you what I think. I'm concerned about what's going to happen for West Virginians and trying to bring goodness to their life tomorrow. I am very mindful and respectful of all of our histories, but at the same time, I want to look to our future. I don't want anyone to feel uncomfortable here. And so from my standpoint, I don't know how to answer it any more plainly than just that. I don't think I have any right to make a decision. I think that's a legislative right. From the standpoint of my personal beliefs, I don't feel like that anyone should feel uncomfortable here. This is our capital. This is our state. This is our people. And so what I am concerned about is your governor is protecting you through this pandemic, giving you the economic opportunities that we're crushed on right now, and then bring more goodness to your lives as we go forward. Not looking back behind us. I never do very well with the rearview mirror. I'm always looking forward.
All right, thank you, Molly. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, you said we're closing in on having tested 10% of the population. Do we have an overall goal that we're trying to hit? And what is the sort of long-term plans for the free community testing?
Well, I think every day, let me go at it backwards. I think every day we get more and more testing capabilities. And the more tests we have, the better we'll be. That's all there is to it. The reason I say we're closing in on 10% of our total population is that There are, I think, 10 or 12 states in the country that have achieved that so far. We want to be right in there in that group. And so we're closing in on it. We're closing in on it real quick, and we'll be there before long. And that's the significance of the 10%, only from the standpoint that there is no real goal in my mind that says, well, if you get to 12%, you're there and all that. No, there's no goal. You know, the whole thing is at 10%, you're in a pretty select group as far as the number of states that are at 10% thus far in the country. And we want to be there and always be in that select group as we go forward as a state in our nation. But we want to continue to test and test and test and test, because it just gives us more and more information.
All right, thank you, Charles. Governor, I'll turn it back to you.
Well, I think we've got a lot of really good questions today. I appreciate that, and I'm going to end by just saying this. And again, West Virginians, you have been very kind to bestow this incredible honor on me. And you've entrusted in what I've been telling you and guiding you through the wickets of this terrible pandemic. The numbers that we've produced and what we've done within West Virginia are an absolute miracle, a miracle beyond belief. And we're going to all say that God above has just directed us through the wickets to be able to produce these numbers. 88 deaths. A cumulative positive test rate percentage of 1.71. Do you realize that just yesterday I was on a call with the vice president, and there was 2 states, I think one was Maryland and the other maybe was New Jersey. They were celebrating beyond belief. They were celebrating the fact that they had gotten to 5-point-something%. Now look, we had days back in early May when we were at 5-point-something%. We're at 1.71% today. Absolutely, West Virginia, you have done the unbelievable. But now, as you've been kind to entrust in me, I want to be just flat James with you. You see, I want to be Jimmy all the time, Jim sometimes, and then there's times that I have to be James. And I want to just tell you just this. If you don't listen and wear your mask, you're going to have loved ones die. Without any question today, I and a lot of us are really much more hesitant about bigger gatherings of people, and maybe even much more a proponent to restrict bigger gatherings of people than we were a week ago or 10 days ago. West Virginians, I would say to you as the straightest talk, what is it really going to take for all of us to awaken to a situation that we have got to protect ourselves at all times? I've said it 1,000,000 times. This disease and virus is still with us. It can whiplash right around and kill us. This is not some smoke and mirrors. You know, this is reality. If we don't listen and really, truly, truly do everything in the world to protect ourselves, and if we do, we'll be able to enjoy a dinner somewhere, the possibility of a movie somewhere, the possibility of a picnic. We'll be able to enjoy those things in West Virginia, where there may very well be places that they can't enjoy them. We'll be able to do that if we'll just do what we've already done. If we don't, we're going to lose people. We're going to have people die. Now, I don't know how it gets any more serious than that. When you say to somebody, listen, if you don't do this and do this correctly, you could die. Please, come on, West Virginia. You've already knocked it out of the park so well. Please continue to do so. Right here in Preston County, right here, I have a report just laid on my desk. It's a press release, or it's an article. I guess it's a press article. In Preston County, there was a bunch of kids or people that went to Myrtle Beach. Just an innocent vacation, went to Myrtle Beach. They come back, and there's 7 of them now that have been tested positive. Now there's a recommendation by the local health departments is saying if you have traveled recently to Myrtle Beach, contact your local health department and be tested. Every day, look at the news. Just watch the news. Watch what's happening. Across this country, this killer virus is still rearing its ugly head. Now, on the other hand, right over here on this side, there's all kinds of news out to drugs that are diminishing its lethalness. What we've got to do is just as simple as this, and I've said it until I'm blue-green, and that is just this. We have got to get to this side without dying on this side. And by this side, meaning that's the drug that will ensure us safety. We got to be able to get there without dying. And how do you get there? Wear your mask. Do what you got to do. Social distance. Wash your hands. Elderly, stay away. Stay home a little bit longer. Help the elderly. Anybody that's got a chronic illness, help them. Watch when you travel out of state. Be careful. Be really careful. Take care of yourself. Please, please, West Virginia, listen to me. We have got the greatest opportunity in the world right now, and we don't want to mess it up. Thank you so much.